Do you feel your knees getting stiffer and more painful each morning when you get out of bed? For many people in their 60s and beyond, that sensation has become almost a daily routine. My name is Dr. James Walker, a rehabilitation specialist with over 30 years of experience working in community health centers. Throughout my career, I've worked with thousands of older adults, people who have grown used to living with pain, no longer expecting any real improvement. They often say, maybe this just comes with age. But I don't agree. Getting older doesn't mean we have to accept pain as a part of life. And today, I want to share a solution I've tested for years. One that's simple, safe, drug-free, and something you can do right at home. We call it the foot patch method. It has helped many people ease their back pain, knee discomfort, and hip tension without hospital visits or expensive procedures. Just a few minutes a day. It's not magic. It's a small, practical step that can truly make a difference in your daily life. You can choose to keep enduring the pain or start taking care of yourself in a more thoughtful and realistic way. If you've ever wondered how something as small as a patch under your foot could possibly affect your knees or lower back, here's what I want you to understand right from the start. Your feet don't just carry the weight of your body. They're also home to a network of important nerve connections. Both modern medicine and holistic healing systems recognize that the soles of our feet are linked to various organs and functions throughout the body. In fact, traditional Asian medical practices, like Chinese and Japanese medicine, have long viewed the feet as a mirror of the entire body. According to these systems, different areas on the bottom of your feet correspond to specific body parts or internal systems, from the knees and lower back to the digestive and circulatory systems. This idea isn't just cultural anymore. In recent years, several research institutions in the U.S. have begun validating the practical benefits of these methods. One study published in the Journal of Alternative and Complementary Medicine found that stimulating reflex points on the feet helped ease knee pain in older adults, especially when done at night, when the body naturally enters a healing phase. I still remember one particular case. Linda M., 76 years old, from Oregon. When she first came to see me, she had to walk with a cane because of severe nightly knee pain. She told me she'd tried everything: physical therapy, medication, even some traditional remedies, but the relief never lasted. I gave her one simple suggestion: try it for 1 week. Each night, apply the patch to these two specific points on the soles of your feet. Don't expect a miracle overnight. Just pay attention to how you feel in the morning. The reason I started with her feet wasn't because of some quick fix. It's because the foundation of your body, quite literally, starts with your feet. If your base isn't stable, everything above it can be thrown off. Just like you can't build a sturdy house on a weak foundation. 5 days later, she returned, without her cane, and told me she was finally able to get out of bed without that heavy, dragging feeling. This method doesn't require any special equipment or expensive treatments. But there's one important detail: placement matters. Each area on the sole of your foot connects to a specific part of your body. If your goal is to relieve knee pain, look for the slightly sunken area just beneath your toes. It often feels a bit sensitive when you press on it. For lower back pain, the ideal spot is about an inch to an inch and a half above the heel. And for neck and shoulder tension, focus on the outer edge of your foot, right beneath the pinky toe. Apply the patch before bedtime and leave it on for at least 6 hours. This is when your body naturally switches into repair mode, all while you sleep. I understand that many people still have doubts about how effective this method really is. That's why I want to share a few real-life cases, not just theories, but actual experiences from right here in our country. Margaret L., 82 years old from Arizona, had been told by her doctor that she needed knee replacement surgery after years of joint degeneration. But she was concerned about the risks and long recovery time, so she declined. Instead, she began using foot patches every night. And the result? Within just 2 weeks, her pain noticeably decreased. After 3 months, she was able to walk to the grocery store without a cane. With tears in her eyes, she told me, "I never imagined something this simple could give me back my freedom." So what makes this method work? The answer lies in the wisdom of both Eastern and Western medicine. In traditional Eastern medicine, the soles of the feet are filled with pressure points and act as a connection to the body's energy pathways. When this energy becomes blocked, symptoms like pain, fatigue, or poor sleep can appear. Stimulating the right areas helps release that blockage, which in turn reduces discomfort and helps restore balance within the body. From a Western medical perspective, neurologists explain that the soles of our feet are rich in nerve endings and tiny blood vessels. When stimulated, signals are sent to the brain that can reduce inflammation, improve blood flow, and regulate the autonomic nervous system, all of which play a key role in managing chronic pain, especially in older adults. Now, to get the most out of this method, there are 3 simple tips I always recommend to my patients. 1. Gentle massage before applying the patch. Use your fingertips to gently massage the soles of your feet for about 5 minutes. This helps soften the tissues, boost circulation, and makes the patch more effective. One of my patients, Ellen R., age 76 from Minnesota, told me she felt results much faster after adding this step to her nightly routine. 2. Drink a warm cup of ginger tea. Ginger naturally helps reduce inflammation and improve circulation. Robert T., 83 from Colorado, said that combining ginger tea with the patch helped ease his knee pain so much that it no longer interferes with his daily life. 3. Elevate your legs after applying the patch. Place a small pillow under your legs to raise them above heart level for about 15–20 minutes. This reduces pressure on the joints and supports better blood flow. Carol A., 72 from Pennsylvania, shared that since trying this, she's been sleeping more soundly and no longer wakes up from pain during the night. Of course, like any method, this one can be misunderstood if not used correctly. Here are 3 common misconceptions I often hear, along with what I hope you'll keep in mind. Misconception 1. It's just a temporary fix. The truth is, when used consistently and applied correctly, this method can help address the root cause of your pain. For example, Henry K., 80 from Florida, had lived with arthritis in his knees for over a decade. After 6 months of using the patches properly, his pain reduced by more than 90%, and he can now walk around his neighborhood without any help. Misconception 2. The stronger the patch, the better. Not true. Especially for seniors with sensitive skin, a patch that's too hot or overly stimulating can cause irritation. It's not about strength, it's about placement and consistency. Misconception 3. It works instantly for everyone. Each person's body is different. Some people feel better in a few days, others may need a few weeks. What matters most is sticking with it and not giving up just because you don't see results right away. With a bit of patience and a few simple adjustments, you can turn this small daily habit into a truly effective tool for recovery. As I often tell my patients, good things take time, but time is always worth it when you invest it the right way. A few things to keep in mind when using foot patches. Always wash and dry your feet before applying the patch. Moisture can prevent it from sticking and reduce its effectiveness. Don't leave it on too long or use too large a patch. 6 to 8 hours is enough. Using it too tightly or covering too wide an area can trap heat and restrict circulation. Replace the patch daily. If needed, change its position every 1 or 2 days to avoid skin irritation. Don't wear it all day. If your skin is sensitive, start with 4 to 5 hours and monitor how your body reacts. No patch. You can temporarily use fresh ginger or aloe vera gel. While not as strong as medical-grade patches, they can still provide a mild warming effect and temporary pain relief. If you have diabetes, ask a loved one to help. Nerve sensitivity in the feet may be reduced, so having someone else observe can help prevent unintentional injury. When you commit to a simple habit like applying a foot patch each night, the changes you feel go beyond the physical. They touch your spirit as well. I've had the privilege of walking alongside many people on this journey, and what they've experienced is truly worth sharing. Take Mr. Frank W., 78, from Utah, for example. After a knee replacement surgery a few years ago, he still struggled with lingering, dull pain. I used to love traveling solo, but after the surgery, even thinking about hills or stairs made me hesitate, he shared. One day, he stumbled upon a YouTube video that introduced the idea of using foot patches to support chronic pain recovery. Skeptical at first, he decided to give it a try anyway. During the first week, the pain persisted, but by the third week, he started noticing that his legs felt lighter in the morning. For the first time in years, I got out of bed without needing to stand still for minutes before I could walk. A month later, he booked a trip back to his favorite resort town, this time with friends. He said, walking through those familiar little streets, it felt like I got back a piece of life I thought was gone. Then there's Mr. Stephen R., 81, from Oregon. An avid fisherman, he used to spend hours by the river each week. But after developing lower back pain and sciatica, he had to set aside his passion. Standing too long or carrying gear became too difficult. Just looking at my fishing rod made me shake my head. I thought that chapter of my life was closed, he said. After a recommendation from his doctor, he began applying the patch to the reflex point linked to the lower back. There wasn't much change in the first month, but he kept going. By the third month, he noticed less fatigue and more ease standing for longer periods. Eventually, he returned to the river with his son. When I felt that fishing line tug again, it felt like I had returned to who I really was. Not because I caught a lot of fish, but because I was there, doing something I once thought impossible. And then there's Ms. Caroline J., 70, from New Mexico, a retired floral design teacher. After developing tendinitis in her wrist, she had to pause her classes at the local community center. Even just holding scissors hurt. I thought I had to say goodbye to teaching for good. A family member encouraged her to try foot patches on the reflex point linked to her wrists. At first, she didn't see how feet and wrists could be connected, but she stayed consistent. After 3 months, she could use scissors again without pain. Now, she's reopened her small class and continues to bring joy to fellow flower lovers. These aren't miracle stories. They're the result of small, daily choices made with patience and realistic hope. If you've ever had to let go of something you love because of pain, if you've hesitated to step outside because you're afraid of falling, if you've thought you've missed your chance because of age, maybe it's time to begin again, not with anything dramatic, just a small patch placed in the right spot at the right time. Remember these 3 simple things. Apply it to the correct reflex point. Take a few minutes to relax before bedtime. And stay consistent each day. One morning you just might realize, today I got out of bed and I didn't wince from the pain. One of the most encouraging shifts in senior healthcare in the U.S. in recent years is the growing openness within the medical community toward supportive therapies rooted in East Asian traditions. As long as these methods are evidence-based, non-invasive, and easy to adopt, they're gradually being integrated into broader care programs for older adults. Today, leading healthcare systems like Cleveland Clinic, Mayo Clinic, and integrative medicine centers in California, Oregon, and Massachusetts have started incorporating therapies such as foot reflexology, gentle acupuncture, acupressure, and pressure point stimulation into their chronic pain management strategies. These approaches aren't meant to replace conventional treatments, but have shown real promise in helping older adults reduce their reliance on pain medication, improve sleep quality, and regain better mobility. Within this more holistic picture, the use of foot patches is also beginning to be recognized as a helpful addition, especially in rehab centers, nursing homes, and home care programs. Many physical therapists are now using foot patches as a gentle way to stimulate peripheral nerve reflex zones on the soles. The goal isn't to cure disease, but to support the body's parasympathetic nervous system, improve sensation in the lower limbs, and relieve muscle tension, factors that often interfere with daily functioning in older adults. Dr. Sandra Miller, a rehabilitation specialist in Texas, shared the following. We don't promote foot patches as a replacement therapy, but in a rehabilitation setting, where patients can use them at home along with slow breathing, warm water intake, and better sleep hygiene, they've made a real difference in quality of life. Many of my patients report sleeping better, walking with more stability, and feeling more in control of their bodies. If you're considering giving it a try, here are some simple steps that can help you use this approach effectively. First, talk with a local healthcare provider. Consulting with your primary care doctor, a home health nurse, or a physical therapist can give you peace of mind, especially if you have other health conditions like diabetes or vein issues. Second, integrate it into your current recovery routine. If you're already doing physical therapy exercises, think of the patch as a complementary step afterward. After movement, your body tends to absorb light stimulation more easily due to better blood flow and a relaxed nervous state. Third, create a quiet personal care corner at home. You don't need special equipment. Just find a quiet space, a comfortable chair, soft lighting, and a few minutes without distractions. Some seniors even enjoy playing soft music, lighting a scented candle, or sipping warm ginger tea before applying the patch. Fourth, focus on how you feel, rather than waiting for quick results. No need for complex tracking. Just jot down a few notes each week. How you're sleeping, whether your steps feel lighter or if your mood has shifted. Over time, you'll likely notice improvement in ways you didn't expect. Across the U.S., many senior wellness programs are shifting toward the philosophy of working with the body instead of treating against it. In that spirit, even a small foot patch can become a catalyst for positive change if you trust the process, stay consistent, and adjust thoughtfully. Feeling better doesn't always have to come from a clinic or a prescription. Sometimes, it starts with one small decision each day, like spending 10 quiet minutes in the evening caring for your feet, taking a deep breath, and truly listening to yourself. Whether you live alone, are recovering from an injury, or simply want to stay active and independent, this might be one of the most gentle, practical, and accessible ways to begin again. Placing a small patch on the sole of your foot may sound simple, maybe even too simple to take seriously. But sometimes, it's the smallest, most consistent changes that lead to the biggest transformations in life. Just like brushing your teeth every night or changing into pajamas before bed, adding one more gentle step to your daily routine can naturally become part of how you care for yourself. No pressure, no complexity, just a quiet act of self-care. Don't wait until the pain keeps you up at night before looking for a solution. Think of this as a proactive way to protect your mobility, independence, and the quality of life you deserve. And if you're thinking, I've already tried everything, how would this be any different? I'm not asking you to believe right away. I'm simply inviting you to give yourself one more chance, this time not by pushing harder but by listening. Gently, without pressure. You don't need fancy equipment. You don't need to understand medical terms. All you need is a little time, a little patience, and the willingness to take that first step. I hope that each morning feels a bit lighter, each step becomes a bit steadier, and each night before bed, you feel more in control of your own path. Thank you for taking the time to listen. And if tonight you decide to try, just one small patch, it might just be the beginning of your journey back to freedom, confidence, and the parts of yourself you thought were gone. Thank you, and I'll see you in the next episode.